You are watching Royal Advanced Net TV. Members of the public seeking services at the health facilities in Bondo sub-county have registered improved services in the past 1 year, thanks to a visual suggestion box introduced by community-based organization in the area. According to the members of the public, the online suggestion box, dubbed Mabox, enables them to give feedback on the services rendered, both positive and negative, which later shared with the relevant authorities without mentioning their names.
My name is Tracy Iminza Asaza. I work at Nyimine Empowerment CBO as a project officer for one of the projects. It's called We Lead. And this project, basically, it's for advancing the sexual reproductive health and rights of young women in their diversity. And when I say young women in their diversity, I mean young women with disability, young women living with HIV, and young women who identify as LBTI. We are here to get to listen to the challenges that rights holders face while accessing services at the facilities that we work with. And these facilities are Capio Health Center, Cambajo Dispensary, and Bondo Referral Hospital. Our rights holders, this is a project that we've been doing as Nyimine Empowerment CBO, and it's called Living the Dream. And the Mabox that is there, that has been mentioned, it's just an online platform where rights holders give feedback of how they have received services. It's just the perception of how they have received services, and it ranges from waiting time, how they were received at the facility, if they were discriminated upon, if they were asked sensitive questions that do not agree with them. Yeah, basically it's just affordability, accessibility, and acceptability of services. That is what Mabox assesses. And now today we are seated with the rights holders to just listen to the challenges they are experiencing while accessing services, as well as the good practices that they see that is happening in these facilities while they access services. So we are here with duty bearers. So at the end of the day, we'll chart the way forward after the rights holders have spoken their side and the duty bearers have listened and also spoken their side, and then we'll have a way forward or
work with the African Gender and Media Initiative Trust, that is GEM Trust for short, and we are women's rights organizations that's focused on advancing gender equality through research. And for us, we've been implementing the We Lead project, which has been key in the supporting young women, whom we call rights holder, to claim their sexual reproductive health and rights. And we do this in collaborations with other organizations within the project. We call them core members, that is Community of Action members. And that also includes Nyakbo, Nyimine, CBO. And today we are here to have a listening session in partnership with Nyimine, with the rights holders, that are the young women, the duty bearers, as well as the healthcare providers. The essence of this listening session is not pointing of fingers or accusing each other of not what has been done, what hasn't been done. It is to provide a safe space where the three parties involved are able to articulate and share their experiences when it comes to accessing health within the facilities, as well as the provision of those services within the facilities, and have a platform where they are not only able to share but also come up with solutions to some of the gaps that may be identified. The listening sessions for me have been very powerful indeed, because we are able to counter some things like misinformation in these very sessions. The details or the facts are made clear right there and then, and it's picked up, and people are able to move and ensure that their health outcomes are achieved. Like, they're able to know, if I go to this facility, this is what I expect.
I'm from Capio. Chenye kimetuleta sana hapa, tumekuja kwa session ya kuongea. We've just come to interchange kuongea watu wa Kambajo, watu wa Kapio na watu wa Bondo. We just want to know how Kambajo gets services, how Kapio gets services, and how Bondo gets services. I can say services ziko poa juu baada ya kupata service tuko na penye tunakaa, tunaitwa, then you give the feedback venye umepata services, but ziko poa. Tangu Nyekubo wakuje, the services are good. They are good that ma services providers, they are nowadays wanahudumia watu vizuri, wanaongelesha watu vizuri, na you can say your problem without fear. Yeah. Tangu Nyekubo ikuje na ilete kitu inaitwa Mabox. Mabox ndio hiyo yenye mkishahudumiwa mnapeleka views zenyu. But it is good, ni private. Ukishasema hakuna penye watandika jina kati umesema. Sasa you talk freely. Nowadays services ziko poa. It was long time, but saa hizi services ziko sawa, hakuna complaints, na madawa kama haiko, it's just out of stock. Si ati ziko na tumenyimwa, ni out of stock. Sasa pia ni request tu kwa government, hata kama zimeisha, at least walete mapema juu. For now we are suffering, by the way. Aziko, they are out of stock. Dawa ya malaria ndio utapata, but hizo zingine utaandikiwa uende ununue, na si ati wamekunyima, they are not there. What?
Mtoto unampatia nini vile amevunjika hivi? Kwa maana mwaka mmoja na 2 months.